Mental health is one of the most critical yet oftenly overlooked aspects of overall well-being. Social media has also becoming a breeding ground for myths and unscientific claims.
It can cause direct harm to a person by virtue of the treatments used, pseudoscientific treatments that can be harmful. Sometimes it can result in death.
Heuristics, shortcuts, mental shortcuts that help us make quick decisions.
Cognitive behavioral therapy, or CBT, is one of the most evidence-based treatments that we have. There's a lot of warning signs that could indicate that something is a pseudoscientific treatment or pseudoscientific approach. Identifying the difference between science and pseudoscience is not always so clear-cut. It's very important for families to increase their mental health literacy. When people don't understand the nature of mental disorders, it can lead to stigma.
In each episode, we dwell into the realms of wellness, exploring the latest trends, expert advice, and practical tips to help lead you a happy, healthier life. We aim to bring a broader perspective to our American audience on issues that impact your daily life by interviewing guests from the US and around the world. From nutrition and fitness to mental well-being and beyond, we're here to empower you with knowledge and inspiration. So whether you're looking to boost your energy, revamp your diet, or simply trying to find a balance in your lifestyle, you're at the right place. Join us as we embark on a journey towards a better, brighter you. I'm your host, Dr. Amir Khan, and together let's unlock the secrets to living life to its fullest. Mental health is one of the most critical yet oftenly overlooked aspects of overall well-being. It shapes our emotions, thoughts, and behaviors. It plays a vital role in how we navigate life's challenges and build meaningful relationships. Despite its significance, mental health is frequently misunderstood, and stigma surrounding mental health issues prevents many from seeking the care they deserve. It's particularly true when it comes to conditions like addiction, which is often treated with judgment rather than empathy and care. Social media, while a powerful tool for connection, has also becoming a breeding ground for myths and unscientific claims that often mislead those seeking help the most. This makes the role of professionals who advocate for evidence-based practices and provide clear, accurate information more important than ever. Understanding mental health and its connections to addiction requires expertise, compassion, and commitment. Welcome to another episode of Khan Clinics, powered by the health section of American Muslim Today. I'm your host, Dr. Amir Khan. Our guest today is Dr. Jonathan Stea. He's a distinguished clinical psychologist and an adjunct professor at the University of Calgary. He's widely recognized for his commitment and work in mental health and addiction. He's dedicated his work to growing concerns surrounding mental health and addiction, using scientific evidence to counter misinformation and the stigma that surrounds it. He's a two-time winner of the University of Calgary Award for Excellence in Clinical Supervision and co-editor of the books investigating clinical psychology, pseudoscience, fringe science, and controversies. He's published extensively in Psychology Today, other publications and outlets as well. One of Dr. Stea's most notable accomplishment is his book, Mind the Science: Saving Your Mental Health from the Wellness Industry. The book provides a critical look at the misinformation surrounding alternative therapies and emphasizes the importance of seeking scientifically supported care for mental health. His work has become and made a lasting impact already on the mental health field by promoting scientific literacy. Dr. Jonathan Stay, welcome to the show.
Dr. Khan, thank you so much for that kind introduction. It's my pleasure to be here.
Let's dip right into it. We're going to start off with your book, Mind the Science. You stress the importance of critical thinking when approaching mental health care. Tell our audience, how can individuals strengthen their critical thinking skills to better assess the resources that are available to them?
That's a great question, Dr. Khan, and it's a hard one. Critical thinking is important when it comes to evaluating not just scientific claims, but also knowing how to best seek help. How do we evaluate what credible sources there are? And it's not an easy thing. Part of the misinformation landscape nowadays that exists on social media is a very polarizing and divisive place where we get a lot of mixed messaging. So it's a very hard question to answer. I would say, and I would encourage people to lean on professional organizations that have a lot of experts under them. So, for example, in Canada and the United States, that's the Canadian Psychological Association, that's the American Psychological Association, and different provinces and different states will have professional associations where they can go to find facts and resources and tips. So I think that's a really good starting point.
Excellent. And tell us, how does your book address some of these issues?
I wrote my book to try to empower and embolden people to take mental health into their own hands by essentially teaching the language, what I call pseudoscientific grift, or the language of pseudoscience and the language of alternative medicine ideology or ideas, because I think that's how a lot of the misinformation on popular media and in social media spreads. So by reading the book, people can start to see things like 9 warning signs or 9 red flags of pseudoscience or alternative medicine tropes and propaganda tactics. And I think when people can come to learn what these warning signs are and what these tropes are, they're better positioned to identify them and to avoid them. And that's important because I want people to make informed decisions when it comes to their mental health and to not be duped by people, let's say an Instagram influencer or a wellness grifter online. And it's important to know the language that they're speaking. And that's kind of the goal of the book, is to help unearth that language and help people become versed in it.
Thank you for answering that question. Tell us from your perspective, how does misinformation contribute to public confusion or harm, particularly for those, as you said, who are seeking out help and or maybe in addiction-related issues?
What helps me understand the topic is that pseudoscience can be harmful in at least 3 ways. So the first way that it can be harmful is that it can cause direct harm to a person by virtue of the treatments used. So there are particular pseudoscientific treatments that can be harmful. Sometimes it can result in death, but more often it can just result in a deterioration of, say, mental health symptoms or health symptoms. There's an entire scientific literature on harmful psychotherapies. So that exists, and that's sort of a way in which it can be harmful. But there's another way that pseudoscience can be harmful, which is indirectly, because when people are wasting time going and receiving pseudoscientific treatments, it can be financially harmful, and they're wasting a lot of time and resources when they could have been seeking evidence-based care, treatments that are more likely to actually help them. And that's not a good thing, because while they're wasting that time, their mental health symptoms could also be deteriorating. Right. And at the third level, pseudoscience can be harmful at the societal level, kind of at large. When misinformation is allowed to spread and pervade through our culture, it can really undermine public health, and it can inform people's health decisions, and they can end up making the wrong decisions when it comes to their mental health by not choosing treatments that are helpful and For example, not even believing particular misinformation claims, things like mental illness doesn't exist or psychiatric medications are more harmful than helpful. That is a really bad piece of misinformation that has unfortunately become baked into parts of our culture, and it's important to debunk those.
Thank you for clarifying that. That's an excellent response, Dr. Jonathan. Dr. Jonathan, let me go on to a similar sort of question. And that's we know social media platforms spread misinformation. They're a good source, but they can be, like you described, pseudoscience, misinformation, unproven treatments, harmful advice, heuristics, shortcuts, mental shortcuts that help us make quick decisions. How do you think heuristics influences the way people think and perceive and seek mental health treatments? And are there risks involved with these shortcuts?
Absolutely. I mean, we all think in shortcuts. That's how our brains evolved. We each have personal biases and cognitive biases. And unfortunately, sometimes, I mean, they evolve because sometimes our brains need those heuristics. It's too hard to compute all of the information that we have in our environment. So we need shortcuts because they're efficient. But they also can get us into problems when we rely on them too much. So, for example, we know that people are more likely to fall for misinformation when they rely on those shortcuts, when they rely on intuitive thinking styles, say, rather than accessing that more critical thinking or analytical style of thinking that we mentioned before. So that's one way in which it can actually cause harm. And so one way in which to help people kind of combat misinformation or not fall for it is to really pause and check before they share and before they believe the information that they're receiving on social media.
Excellent. Okay. Well, thank you again for that answer. That explains it. You've spoken a lot extensively about the dangers of pseudoscience. You just gave us a couple of examples here. How do you view homeopathy as an approach for treating psychological disorders? And what's the evidence that it suggests it's effective or may not be effective?
Well, homeopathy is one of those treatments that we can call an unequivocal pseudoscientific treatment. So, what I mean by that is that it's unfortunately, a very clear cut case of pseudoscience. And the reason for that is that the claims that homeopathy makes is completely divorced from the current scientific literature that we have. So, for example, homeopathic products work by capitalizing on what they call the law of minimum dose. And that means that an active ingredient becomes more effective when it's diluted out of existence and that water somehow remembers the molecules that were once in it. That doesn't make sense according to the entire field of pharmacology that we have, or even from a physics perspective. And so, in that way, homeopathy doesn't make sense scientifically. And any findings or any research findings that would show that it works, unfortunately, wouldn't be able to show that it works beyond a placebo effect because the active ingredients or the way in which homeopathy is said to work, it just can't happen. And therefore, and then when you actually look at the scientific literature that we have, it finds that homeopathy is not effective for any mental health concern that we have. And in fact, it's not actually a helpful treatment for any health condition because it simply can't work, again, beyond the placebo effect.
Some of our audience consider homeopathy as being proven by history or an alternate medicine treatment option. How does your book, or as a matter of fact, your work, address these concerns?
It's a very complicated topic because people's beliefs will drive them to turn to alternative medicine. And there's lots of good reasons why people will turn to alternative medicine. In a lot of cases, even our best evidence-based treatments that are part of mainstream medicine won't be effective for everyone. So I totally understand that and I get that. And we have to show empathy for everyone. All of us want to be able to treat our health ailments. Unfortunately, I mean, the best way that our codes of ethics and our legal standards of practice of bona fide health professions do that is by using science to guide our decisions. And just because we have gaps in our knowledge and gaps in our healthcare systems and treatments, that doesn't mean or signal a call to fill those gaps with exploitation and pseudoscience under the guise of, say, alternative medicine or functional medicine or integrative medicine, or however you want to describe it. Because at the end of the day, just from a scientific perspective, again, something like homeopathy just doesn't jive with the current scientific literature.
Thank you for explaining that, Dr. Jonathan. Jonathan, let's go on to something that's very core to psychology or other forms of treatment, and that's some of the principles that have involved cognitive behavioral therapy, CBT. Reflects its purpose and effectiveness. How do you correlate that, incorporate that into your practice?
Cognitive behavioral therapy, or CBT, is
Yes.
one of the most evidence-based treatments that we have for a
Mhm.
variety of mental health concerns and a variety of addiction concerns. Yeah, I happen to use cognitive behavioral approaches in my everyday clinical work. I've been doing that for over a decade. We have good evidence that it can be helpful, one among many evidence-based treatments.
Give us an overview or a brief overview. How do you apply that and its origins and some principles that involve CBT and that the ones that you use or have described in your book?
Cognitive behavioral therapy, essentially at its base, rests on the idea that our experiences can be slowed down and broken down into three broad domains. We have thoughts, we have behaviors, and we have feelings or emotions. And from a CBT perspective, our thoughts, feelings, and behaviors are all intertwined and connected. And so the therapy really involves trying to address our thoughts. That's sort of the C of CBT, in which is the cognitive component. And so by addressing thoughts is trying to help people develop a way of thinking that is more helpful and more balanced and more realistic. And then there's also the B of CBT, which is more the behavioral aspect. And that's also a helpful thing when it comes to, say, anxiety disorders. It's trying to do something that we call exposure therapy. So exposing people to safe situations that challenge their anxious thoughts to help them overcome the anxiety symptoms that they're having. We have other behavioral techniques in CBT to treat someone's depression by helping them do pleasurable and effortful activities. So there's a variety of different strategies and techniques that CBT therapists or CBT approach would warrant.
Thank you for explaining that. Thought, behavior, feeling. Excellent. In your in Mind the Science, saving your mental health from the wellness industry, you differentiate evidence-based mental health practices from alternative medicine. What key indicators or red flags should individuals watch for when evaluating whether a treatment or approach may be pseudoscientific and or potentially harmful?
There's a lot of warning signs that could indicate that something is a pseudoscientific treatment or pseudoscientific approach. In my book, I outline 9 such red flags that people can look
Mhm.
for. And what we want to help people understand is that identifying the difference between science and pseudoscience is not always so clear cut. It's more of what we say a probabilistic endeavor, meaning the more warning signs that we see and that we hear, the more likely it is, or the more probabilistic it is that we've unearthed something pseudoscientific. So I can give some examples. So one of those warning signs, say, is using sciencey sounding language to dress up false claims or false treatments. So, using sciencey sounding language that is really out of place. So, for example, I have a treatment that claims to change the cellular mechanisms of the quantum computational frequencies within your brain. So what I just said is complete nonsense, but it sounds sciencey. So that's sort of one red flag to look for. Another one is, like I mentioned before, in the case of homeopathy, it's claims that are divorced from the broader scientific literature. So when people are saying that their treatments can, say, completely change how our energy fields are manipulated or balanced, or that water can remember molecules, or that
Mhm.
their treatment can work at the quantum level to change their brain chemistry. These are claims that just they don't jive again with the broader scientific literature. So that's another kind of warning sign. Another one would be we call the elevation of anecdotal evidence, or the use of testimonials on websites. So if a website or an influencer is saying that their treatment works because Bob or Jeff or whoever says that it can work, that doesn't necessarily mean that it can work. We need more rigorous scientific studies to show that it works, not just because a particular person says that it does.
Excellent, excellent. And I'm sure our audience will love to read more about those warning signs in your book. Let's go on to another question that has popped up and some of the audience have been asking about, and that's about families. How important is it families educating themselves about specific psychological disorders their loved ones are dealing with? And are there any common misconceptions families should be aware of?
I think it's very important for families to increase their mental health literacy. And what I mean by that is increasing their understanding of the nature of mental disorders and the nature of mental health concerns. Because when people are experiencing mental health problems or disorders, it can be very isolating and lonely and hard on people. And one core component of mental health treatment involves helping people who experience mental health concerns lean on their supports and to reach out for help, because it can be so isolating. And if the supports that they reach out to don't validate them or don't help them or don't understand what they're going through, it just really disadvantages people that are going through those concerns. So it can be very important, because when people don't understand the nature of mental disorders, it can lead to something called stigma, which is basically, it's the idea that people can feel very isolated and shamed and feel prejudiced against themselves because how society and how other people might view their mental health concerns, and that's not a good thing.
Excellent. And thank you for addressing that, Jonathan. That's quite a nice answer. A final question, and that's on your book. Tell us what inspired you to write it, and what do you hope, what sort of message would you like to disseminate to the community from those who are looking to read your book and have a look what's inside it? What sort of message would you like it to convey to the audience?
I wrote my book because misinformation and pseudoscience can be very harmful for people who experience mental health concerns, and it can harm those who we love. And I wrote my book to try to help people become more informed about what misinformation looks like and what pseudoscience looks like, so that they know how to avoid it, so that they can be better positioned to help themselves and their loved ones when it comes to addressing their mental health or the mental health of their loved ones.
Excellent. Well, thank you very much, Jonathan, for sharing your valuable insights with us today. We truly appreciate it. Thank you for your time, and thank you for being with us.
It was my absolute pleasure, Dr. Khan. Thank you so much.
And to our amazing audience, thank you for tuning in for another episode of Khan Clinics. If you enjoyed the show, please share it with your friends. Don't forget to give us a thumbs up. Hit then the subscribe button and make sure you leave your comments with us. Thank you for everyone being with us. Thank you for the opportunity. And I want to thank my team who brought this presentation. This presentation was brought by Khan Clinics, powered by American Muslim Today. Please don't forget to subscribe, share, and comment in Khan Clinics. Thank you.